Right here on the radio, The Breeze, 93.9. Good morning. Let's go to the KUM News Zoom room where Dr. Hoa Nguyen of the Physicians Advisory Group is standing by on what a beautiful Wednesday morning.
Hi, Doc.
Good morning, Doc.
Hi guys, it's beautiful. Yeah, it's not raining, nice and sunny. So it's a nice day.
Yeah, too bad we got to stay home. Good morning,
I know,
Doc.
but it's gonna get better. It's okay.
It's okay. It's going to
It's
get
getting
better.
better.
It's getting better. So, did you guys have the meeting last night with the PAG? What can you tell us?
And just overall, it's a very good meeting. Public health, is there. Quarantine team is there, so everybody's there. So we try to make it work together and make a decision to move things forward. Things are getting better, but we're not where we're supposed to be yet. The hospital census are down. I think this morning down to 32, and so we hope that it remain low in the next few weeks or so. Basically, there's a lot of confusion of quarantine guideline yesterday. So we basically call everyone on the table and try to set a quarantine guideline that we really like to implement this week, sometime this week. And things need to get ready at the Q factor, but we like to implement, at testing at day 6 and let people go home at day 7 on home quarantine. That's based on the science that we have at this point, and it will catch probably majority, 94-95% of all the positive that coming in. So that's a very good odds, and the rest of the time, people will be home quarantine for the next 7 days with the Sarah Alert on. Sarah Alert is a web based program that people download when they go home, and it's basically just like the patient there in Hawaii. Just report in your sign symptom every day, and someone from public health will get back with you if you have any sign and symptom and tell you what to do. So we really like to push that out this week. So public health, Q factor, a lot of things to get prepared if we implement the new guideline this week.
So you guys agreed that this was actually going to happen. Public Health is ready to roll out this whole Sarah Alert program?
Yeah, they ready to roll out.
Okay.
I mean, they download to some of the physician phone, including my phone on Sarah Alert. I see what's what happened to Sarah Alert and what question they ask and what activity that public health monitors. So I think the Sarah Alert is a nice thing to have, but we say it's not a showstopper. So if we had to roll out this program this week and delay the Sarah Alert for a week or so, we will roll that out because people need to go home earlier. So we really want people to go home on day 7. Again, if they test, so that should be.
As far as the testing, you said on day 6, is that test is going to be borne by the traveler wanting to get out, right?
That's the person's choice. I mean, if they want to stay longer, it's up to them. But if they want to go home early, then we test them out day 6, and the test should be 24 hours. They should get back the next day already.
No, but
so,
if I was in quarantine and I wanted to get out early, do I pay for the test?
No, the test on free.
Okay.
Sabrina, there's no one should pay for the test. So there's a lot of website there that some clinic charge for testing out. I don't see why you have to pay for testing. So again, unless you have absolutely no reason to be tested, then you pay if you want to know. But if you have reason to be tested, it should be free. And, so no one should pay.
Right.
Okay. And so what about what we discussed yesterday regarding the reopening of some businesses? What was discussed regarding that?
you know, we have to move forward with our economy, and again, it's all based on the hospital census, and if our hospital can handle any type of new admission or any type of surge, and the hospital, are in better shape than they are in the past, 6 weeks or so. It's not where we want it yet, so the opening of business will be kind of slow. We're gonna try to discuss with the governor this morning to see if we can reopen some business based on the data that we have in the last P core 2 and 3. There's some business that does not have any positive. That is like a cluster. I mean, you have one or two from the employee is not considered as an infection in that business. So we look at those and we try to decide the best that we can on which business that we can open safely. And we had to present that to the governor, and she had to approve it. So I think probably the next 2 days, she will put out something, that she approved our suggestion or not. It's really, she has business responsibility. So, but we do forward some business that we like to open, and this PCO 1, is really still a decision to make, but doing this PCO 1, we can open some business safely. So
Right,
we're going to
yeah.
suggest that to the governor.
So is one of the we're just hearing
Okay.
that businesses that are asking to be remote. I know some of the suggestions being made. These businesses would reinforce obviously wearing the mask, social distancing with mandatory temperature checks. Also hearing occupancy. Doc, what are you guys thinking if we reopen? Some of these businesses. What would the occupancy be? Because we have to make sure that there's enough room in there for people to be 6 feet apart, right?
Yeah, I tell you, a lot of business on prepare themselves and to make sure that the customer is safe. Okay, so we realize that. The occupancy, it's going to vary from anywhere from 25 to 50%. And again, the governor will have to decide. We know certain business will not do well if they less than 50%. So we realize that we hear their voice, we hear the concern. So we try to make the best decision. I mean, everybody, you have over 30 people there trying to make a decision last night, and
Wow.
it's not a short meeting, but we hope to come up with something that is safe for us to come forward. It's not a single person decision. It's
Right.
Everybody. I mean, everyone from public health is there, all the PACs, got some, the hospital, both of them, GMH, GRMC. So everyone's there. As I say, we make decision based on a lot of voice, and everyone have to agree before this thing move forward. So
Wow.
I'll be the next 2 days. I think she will release that list for you. But
Yeah.
we like to open the business up a little bit, just so people can go forward and there's some normalcy to the last 6 weeks or so.
Right.
Okay.
And so, how much are these outside, Doc? How much are these these quarantine lawsuits? Now we have a lawsuit in the federal court, brought by business owners. So, how much are these outside circumstances affecting the decisions, which, I mean, we've been told are supposed to be based on where we are with the virus?
Yeah, when business can, we live in a free country, and business can sue, and I'm not quite sure it's going to stand in court, except that the case for the quarantine. But no, she have to make sure that Guam is safe for everyone, and that's I think that's a tough decision she makes. So that that lawsuit for business there, I'm not quite sure it's going to stand or not. But for the quarantine factor, what we did last night, and the governor really blessed us on this one, is that she give a thumbs up on the decision making for the quarantine factor on the hardship and the exemption. We're going to put a physician on that panel to make decision, to help make decision. So I think that it is much better if we have a physician on board that can help the quarantine team make a better decision on what best to do with the passenger who apply for the hardship or for exemption based on medical reason to go home early or to testing out early. So I think that going forward, it'd be a better, and hopefully we won't hear anything in court regarding that. Some people think that the decision make in the quarantine is so harsh. It's very harsh. You interview the last person there on the radio in Hawaii. It's the same. Decision have to be made, but hopefully put a physician on board on decision making on exemption to go forward be much better, and we won't hear those cases anymore.
Right. Doc, we've been doing this for 6 months, so who has been making the decision then on these exemptions? The janitor?
I think
What?
basically the quarantine team make decision. As a physician, we have guideline our practice, but we tend to look at not at just a guideline, but to look at the person and everything as a whole. And we treat the patient in many ways. It's not just because the book say this that we treat the patient by the book, So we have to look at everything, all the detail and everything around it to make decision for the patient. So hopefully in the quarantine requests about hardship and exemption, that we use the same logic. You gotta look at the person and everything around them and make a decision rather than just follow the guideline directly. And that's the missing link. And then we have a physician on board just to help make decision.
So, Doc, you're basically saying that the way decisions were being made as far as who gets out of quarantine when they come to the island, it wasn't being made in the most prudent manner? Are you concerned that people with connections were getting to slide?
No, a lot of people make decisions black and white. You either have the guideline to follow or not the guideline to follow. I mean, that's what most people do and like to make decisions based on black and white. But physician-wise, we think differently. So we're not based on the guidelines strictly. So I didn't say that they are wrong what they do. They follow the guideline, and sometimes when you follow the guideline too strict, it can hurt other people. So we're gonna try to work in a different approach. Just like if you're gonna test the children in the Q factor, we're gonna ask the parent for consent to be tested. So if the parents does not consent to be tested, then we will involve the physician in discussion with the patient or with the parents that, hey, your child needs to be tested for a certain reason. And again, we like to have the parents make decision along with us in testing the children rather than just say you had to be tested. So those things, it makes it so it's a two-way street rather than just don't give the parent no choice that your kid has to be tested.
Yeah. Man, Doc, I just got to go back to these exemptions because the one example that I keep thinking about is the one that Marcel Camacho. Yeah, Marcel Camacho. I mean, come on, dude. I've got the pictures of his alleged farm. I've communicated with him. He told me that he was hoping to farm on 18 acres. So to me, how are you an essential farmer if you're only hoping to farm? Because they made it seem like this guy is feeding the poor out here, handing out golai to the people of Guam when that's not even the case. So it's clearly, clearly that is the one glaring example of somebody who I mean, maybe he threw his weight around. I'm a former senator or whatever, and they just got scared. Or maybe it's because he's a Camacho. They're like, oh my God, he's a Camacho. I don't know, but it's just a bunch of nonsense when he gets off, and then people who are coming here to bury their parents are still locked up.
Yes, I totally agree. The home pack agree with you. I think that's a huge mistake, and that hole has been filled. And then I know the governor is not happy with that decision, but that hole been filled, and she closed that loops. There's no more. The only essential people that can go through is the medical people, the doctor, nurse, and the tech. And what else? The flight crew, but no more exemption. No, that she closed the loop on everybody because it doesn't make sense on that one. I tell you, we got a lot of flack on that one, and it's a mistake, and it's not gonna happen. So we reviewed the list of all the exemption in the first 150 something exemption, and they all make sense except one person. So yes, it's I tell you, it's a mistake. It's a mistake, and we can't go around saying anything else except it's a mistake. Yeah, so it's not going to happen again. But going forward, though, the exemption for hardship and medical exemption will be decision making by team, including a physician. We're going to rotate the physician from the physician advisory group. And it's working, we're going to ask the physician and community to get involved, especially a pediatrician in the community, just because, a lot of decision making on testing the child or not it should be made by the consent with the parents with decision from their physician. So if the pediatrician and community agree to participate, if you have a child coming home and you identify, the pediatrician and community, then we should be able to call them and say, can you talk to the parents and get a consent for it to be tested? So that's something that will most definitely help because now, people won't complain that they don't have a decision making on their quarantine. But and we like to get people home, guys. I mean, we really want this thing to happen this week. I think that it will happen this week. I keep my finger crossed.
Okay.
Well, if people keep suing, it's going to happen really fast. So.
Yeah. So, and it's based on education. Again, that little graph that I sent to you a few weeks ago.
Right.
That's the science. That's that we follow. There's no argument about that science. Every website, every speaker talk about that graph, and that's what we follow. So when people come up and say there's no science to it, yes,
Right.
they are.
Yeah.
And
Doc, you're talking about the
graph.
testing window. You're talking about why you test at 7 days, right?
Yeah.
Which is basically because.
I mean, that graph is self-explanatory. I mean, everyone don't have to be medical people to look at it, and that's something that I think that's day one. We should teach people in the community that graph because if people want to know why they get test negative and before they arrive and they can go home, if they truly understand that graph, they say, hey, there's a reason there why people are cautious about it. You do not want to bring anything back to your family. Because potentially, you might have something. And they catch 5 positive quarantine yesterday. That's for those 5 to be in the community, you're going to have a lot of problem, tracing those people. So it helped.
Wait, did you say they caught 5 positives in quarantine yesterday?
Yeah, that's what the JIC report yesterday. 5 in the quarantine.
Okay. Right.
So. That's 5. Can be a lot. Just imagine you have one person come home positive, and you have a family of 5 or 6, and they all go to work. Or that spread really fast. So it helped to have them in a quarantine facility to do that.
If they test positive in the quarantine facility, they move to the government isolation facility, or are they allowed to go home and isolate?
No. If they test positive, they will be moved to isolation. You cannot go home from the Q factor if you test positive. And you have to isolate just like for 10 days, just like outside. If we test someone positive in the clinic, technically they're supposed to be contact with a public health isolation team. They go inspect the house, make sure that the house is adequate for them to isolate at home. If not, they will have a choice to go to isolation facility, which you understand those isolation facilities full. A lot of people in the community opt to go to the hotel to isolate themselves against so that way they won't spread to their family. So those facilities are full. So they do give them a choice. If your house is not adequate, or if you feel uncomfortable at home, you go to isolation facility, and that's strictly volunteer.
Right, but if you are in a government quarantine facility and you test positive, you do not have a choice.
Yeah, you have to go to isolation. Yeah, because you cannot send you home.
Okay.
That's something that that's the best choice to prevent the spreading of the virus, Sabrina. So yeah, because you have to go to isolation for 10 days. Okay.
I wanted to follow up. You said the governor, she participated in the PAG meeting last night. Did you sit in?
The governor is not there last night. She tasked us together with everybody. Like I say, there's a lot of people last night. Everyone in the chain is there. So no one is exempt last night. So the quarantine team, the isolation team, the tracing team, the director of public health, and everyone, the PAC, the GMA, GRMC is there.
What about the Adeloop team? Anybody from the Adeloop participate, listen in?
Yeah, I think the Adeloop team was there too.
Was there any indication about the governor possibly extending this PCOR 1 or stay-home order past Friday?
Last night we have those 3 sub-items, and I tell you, we spent so much time battered to make sure everyone's voice, is out last night to make sure that we have unanimous decision. So we didn't talk about moving out PCOR 1 to PCOR 2. We present this morning, and I'm sure she will act for that one. We have a rough draft how to move forward.
I'm sorry, you were breaking up. So we could possibly look at staying in PCOR 1 past Friday and stay home order?
No, we've started only at 9.
Maria, could you please mute your audio?
Yeah.
I'm sorry, what was that, Dr. Hoa?
Yeah, I'm not sure, Sabrina. I mean, we have a rough draft that passed out last night, and I haven't tell you it's late last night, so I haven't looked at it yet. But we all want to look at this morning and see what the rough draft decide. Okay, so I'm sure she will ask this morning, and so we have to meet sometime this week before Friday.
Oh yeah, you guys are meeting on Thursday. That's right. You guys are still meeting on Thursday.
Yeah. The main thing last night, we wanted to hammer that thing. The quarantine, the decision making for exemption, and the business, and we hammered those 3 out. And it's just a lot.
Right, but you can't give us any indication like what industries or you are looking in terms of businesses we could see reopened on limited capacity.
Because I don't want the industry to get their hope up so high, because the decision, the final authority is the governor. So I don't want to say something and then business
so you're going to get in trouble.
Get owned.
Yeah.
Okay. Well, I mean, a lot of businesses already lost hope. So.
Yeah. So, but I can tell you that her goal is open some business up. As absolutely, I can tell you that.
Right.
and the back goal is open business up. So everyone have the same goal. No. So
who's paying attention to the virus though? If everyone's talking about opening.
We are. So when we open a certain business group, again, we look at the data. We make sure that there's nothing that's basically a cluster or breakout from that business from the last peak quarter 2 and peak quarter 3. So those decisions is not made because I like to open something based on what we have in the past.
So you have data on this. I think Mary Rhodes was the one who was talking about it earlier this week. The need for more information from public health in terms of data clusters. Do you guys have that information?
Yes.
Public health provides that information because she was saying that this kind of information is critical so the decisions are consistent in terms of what's the government. Go ahead.
We know what business have positive in the past, and what they did wrong. So basically, we those decisions make based on those, So and again, moving forward, just like you, we will ask public health to release more data to share with other people, so that way, people is not think that we make decision without any evidence. So the JIC, I think they're going to change the way they report things. That's what I heard. So let's see how they report it. And again, we will get input from the public and try to change the way they put the data out there every day, so it makes more sense for people. And people, number one question is, how come you don't release the name of the business? And I tell you, that's just a hard decision. I'm not a lawyer, so the business have to step up and release it themselves if I'm the business. But again, hopefully by this Friday, we can have some return to some new norm, and we go forward from there. If it look good and the numbers continue to go down, we move further and open more business as the number go down, and it should go down slowly, but it should go.
So just to recap, so by Friday, we're hoping that we're going to see this early test out in quarantine, the 7-day test out. You get tested on day 6. Travelers shouldn't be having to bear the cost for that. Also Friday, we're looking at the possibility of more businesses reopening. And in terms of the extension of PCOR 1 and a stay-home order, we're just going to have to wait and see.
Yes.
All right.
Again, be safe, and again, everyone in the public, make sure you wear your mask. And if you're sick, please stay home. I think as we go further along with this one, people get tired, so even they sick, they go to work, and that's put it in the jam. So if you're sick or you have cough and cold, please stay home. We like to get the number down a lot better than we have right now. Okay.
And the other thing was we're going to put a doctor on this public health team that makes decisions on who gets exempt and no farmers anymore.
Yeah, 100%. Yeah, we're going to put a physician there.
All right, thanks, Doc.
Okay.
We'll talk to you Thursday.
Welcome,
Friday.
Okay, thanks.
Okay,
Wash your hands, Doc. 7:44. Let's what was happening in that meeting last night, Bree?
I don't know, but we need to get in on this Zoom.
Yeah, anybody who's on the PAG, no names, just send us the link. We'll just lurk in the background.
I'm just kind of confused. Like, how come there was no doctor on this exemption deciding team or quarantine team?
I don't know.
That's interesting.